All right, you're going.
Hi everyone, I'm Renee Garvin from the Chronic Pain Program. Please join me now as we do the exercises to help you manage your chronic pain condition. You may want to have a chair nearby, a yoga strap, and a mat, and possibly a pair of hand weights or a TheraTube resistant band if you're going to be using that. Let's get started now with our posture awareness. So if you're going to stand, notice how you're standing through both of your legs. Hopefully your knees are staying in a softened position, keeping the shoulders relaxed, and just allowing your head and your spine and your body to lengthen. So we'll let our arms hang down at our sides now, relaxing our fingers. And let's just take an inhale, exhale breath, and then we'll begin the floating palms exercise. So now as we take our next inhale breath, we'll softly move our hands up to about chest level. Let's exhale it out as we push our hands out in front. And softly we'll return with an inhale breath. And now we'll take it out, exhaling our breath. And our next inhale breath, we'll bring it into a hug-like motion, coming back in towards our heart. Exhaling, we'll take the arms wherever you can go, modify as you need to. And now as we begin our lowering, we will begin with the inhale. And then you're probably ready to exhale now. And then just press your hands and your arms down. So we'll try that a couple more times. Here we go. Inhale. Exhale. Inhale. Exhale. Inhale and hug, back in towards your heart, and exhale up. If you can only go this far, that's where you go. Then you can turn your palms towards the floor. You begin to lower by inhaling, and then exhale. And we'll try one more. Inhale, we raise up. Exhale, we press out. Inhale, we return. Exhale, we go out to the sides. If you can't straighten your elbows, keep them bent. Now we're going to go into a hug and back in towards you. Still be aware of your posture, knees soft. As you lower down, palms face the floor, softly lowering, tall posture. And just notice your feet, how they're positioned on the floor, and then release. Okay. Our next movement will begin with our arms just right here at our sides. We'll continue to breathe normally, pay attention to our posture, and just gently rotate our arms open or outward, and then return them back to the start. So we're going to rotate or open them, and then return. Let's do a few more of those. So just make sure that you don't lock your knees out, that your neck and your back are not arching or protruding forward. And you hold it there for maybe 1 or 2 seconds, and then you just come back to the start. One more time here. So that's a good posture reinforcement exercise. All right. Next one, we'll start with crisscrossing our wrists. We'll take that next breath in as we raise the arms above, and then we'll exhale and lower back down again. Okay, so there's a couple things you might want to do to help yourself be able to tolerate the movement. Modifications would be bend your elbows. You can still raise your arms up with your elbows bent. Lower them back down. Elbows can stay bent. Let's try a few more. Inhale, if you can't raise your arms out to the side, you can raise them out on a diagonal. And exhale, lower down. All right, we're going to inhale again. And exhale, lower down. All right, here comes the last one. And if you are able, you can stay up at the top of your range of motion and just do these little extra reaches, if that's okay for you. Just little lifts or reaches, and then slowly lower, Control the lowering, working on your strength of your arms and your posture. All right. Back down again with our arms. We'll let them relax at our sides. Next, we'll do our head and neck movements. If you can't move your neck, keep it here in neutral and just move your eyes. So here we go. Inhale and exhale. We'll lower our head and our eyes down slowly. And then our next breath, we'll reverse and bring our head and our focus back to the start position. Inhale, exhale, we'll turn and rotate our head slowly, just where you can go. Inhale and exhale as we come back to the center. Another inhale and exhale, we go to the other direction. So you would modify if you have difficulty moving that far into the range of motion. Now we're all back at the center position. Inhale, exhale, we're going to bring one ear towards one shoulder here, and we try not to let the shoulders do the shrug. So if you want more of a stretch, you can gently reach your arms down, and then we come back up. Inhale, exhale, other direction. Now you want to make sure your eyes are still looking straight ahead and not looking down. And back up again. Okay. We're going to move ahead to the shoulder work. We're going to do one shoulder at a time. So pick your shoulder. If you need to sit, sit. Imagine like you have an expensive crystal glass sitting on your shoulder so you don't want it to fall off. You want to keep your arm, your elbow, your wrist, and your fingers relaxed. So what we will do is very small motions, about an inch or less. We're going to take that shoulder and arm up towards the ceiling, and then slowly return it back to the start position. All right, and then we're going to go backwards without a bending of our elbow. So it's just a controlled movement back and then back into neutral. And then we'll go forward without rotating our body and back to neutral, and then we'll take it down and then back into neutral. Okay, so those are our directions. Let's put it all together. Inhale and exhale, and here we go. We'll take it up on the inhale, slowly move it back. Now as we exhale, gently drop it down, and now we come forward. So here we go with our next 2 reps, same thing. Up, back, down, and forward. Here's our last rep. Keeping your posture and your head and your neck aligned, down and forward. Now we're going to switch the direction. So we go up, now we go forward, down, and back. Let's take it up. Remember your breath. Forward. You're probably exhaling, down and back. Last one. Up, forward, down and back. All right. Just settle back into your posture. You can notice the shoulder you just worked versus the shoulder you haven't worked yet. There may be a difference between how your body feels. Let's go to the second shoulder. Crystal glass. Slowly take that shoulder up just a little bit, and then slowly work it and release it down. All right, we're going to go forward here. We only hold it there for about a second or 2. Back to neutral. Keep your knees soft. As we go backwards, relax the fingers. Back to neutral. Last one, down. We don't want our whole body to do this. It's just a little drop down of the shoulder blade. All right, let's put it all together. We're going to slowly move it up as we inhale. Take it forward. Exhale as you go down and back. Now you can make this movement smaller. You can gently hold your arm with your other hand. Just keep breathing and focus on what you can tolerate as we come to our last movement here on this direction. All right, we're going to switch directions here. We're going to take it up, back, down, and forward. Inhale, up and back. Down and forward would be the exhale. Here's our last one. All right, back to neutral. Just kind of shake those arms out a little bit. Let's put them both together, right and left if you can. Soften those knees. Both of them come up just a little bit. We're not forcing anything. Both of them go back. Now we're going to drop it down, and let's take it forward. Inhale as we take it up and back. Exhale, drop it down and bring it forward. We have one more in this direction. Trying to keep our posture aligned. You don't want to feel like you're doing your chin out in the air. All right, we're going to switch the direction. Up, forward, down, and back. Do less is okay. Just making it a smaller movement if you're having discomfort anywhere. So doing it less and smaller. All right. We'll move on to our next exercise. Palms come together. Taking your breath in, we'll take the arms up in front of your eyes and your forehead. If you can, go above your head. Now we'll separate and open our hands, exhaling as we lower the arms down. And then we come back together again with the hands, and we'll try that a few more times. Inhale. And exhale. You can have your elbows bent as you come down, or you can keep them straight. All right, inhale. You can do these in sitting. So if you need to sit, sit. And exhale as you lower down. Tall posture, noticing what those knees might be doing. All right, we're going to inhale here. And if at the top, you can put the backs of your hands together. If you want a little extra stretch. And lower down, exhaling. Tall posture. All right, we'll take it with an arm reach. Reaching one arm up. If you want to reach the bottom hand down, you can. And now we'll switch. Reaching, inhaling and exhaling, keeping the shoulders from doing too much of a shrug. Lengthening from the side of our body, reaching up. All right, and last time on this side, keeping a tall, neutral, vertical line with your spine and your head as we come back down. Let's do our body rotation. So here we go, slowly moving in a rotational motion. Your arms can just hang down at your side, and then slowly rotating to the other direction. It's best to move slow, and then if you feel you can do the motion, you don't have to move faster, but sometimes we can. Your arms can also be held up in the air. And you want to breathe instead of holding your breath, let the breath flow. Or you can just wrap your arms if you want, just kind of around wherever your body is going. And coming back to center posture. We're going to go ahead and do the hip circles. So it's a full circle with your whole body, the lower legs too. So let your shoulders relax here. Now if you can't do the circle, you're going to shift side to side, or you're going to pick a different shape to make instead of a circle. Let's switch the direction of the circle or switch your shape. Feel the bottoms of your feet and notice how your weight shifts over your feet. And so that may take the perspective of the exercise out of your spine and your pelvis and reduce the fear around making that movement. All right, we're going to stabilize through our legs. Stop doing the movement down there. We'll move our arms into position. Do some arm circles here. Arm circles slowly. If you need to, your arms can be down here. You're still going to get the work that we need with our arms. All right, I'm going to switch the circle direction. Go slowly with this. Imagine if you had pencils in each hand and you were going to try to draw a circle out there in the air, keeping good posture. Shoulders are not shrugged up, so we want to keep our shoulders relaxed. Let's lower our arms down. All right, so this would be the time where if you needed a chair or something to hold on to for balance, you would get that nearby you. We're going to do bringing ourselves up on our toes, lifting our heels, and trying to hold it there for about 3 seconds, and then slowly lowering ourselves back down to the floor again. Now remember, you can do this on one leg at a time, or you can do it in sitting. We come up, tall posture, and then slowly lower so that you don't just crash land. Let's try a few more of these as we come up. We hold it for a few seconds. 3 is a good place to start, and then lower back down. Keep the breathing going. Eventually, you may not need to hold on to something. You're working on your balance. And lower back down again. All right, we'll try a few more as we come up. And lower down. As we come up, hold, working the backs of our legs, the calf muscles, and slowly lower. So you can progress that by moving to one leg at a time, which is definitely harder. You can make that your challenge. You can also at this time do a standing leg balance, which is a good exercise for practicing your overall balance. About 10 seconds to start with on each side, and then you can progress that hold. We'll do our calf stretch next, so you may want to have the chair or something next to you. You separate your legs. You're going to lean forward onto the front leg. You can hold on to something, or you don't have to. And you want to stretch that back leg. So you've got to keep the heel down, stretching for about 20 to 30 seconds. So we'll hold it here for about another 10 seconds. And remember to just breathe here. We don't want to hold our breath or shrug our shoulders up. All right, the other way, let's switch legs. I'll just show the other version. You can find a solid surface, wall or a chair, piece of furniture. You can put your foot up on it, hold it there for 20 to 30 seconds. Otherwise, you can do it the same way we did it on the first side. Let's hold it here for about another 5, 4, 3, 2, and release. Okay, you could also sit down and do that stretch by just bending your foot up towards your face. I guess you could try to do it in standing too. And then we have the squat. So you might want to hold on to something. We come down as if we're going to sit in a chair. Our body weight is on the back of our feet, our heels, and you hold it there for about 3 to 5 seconds, and then we come back up out of that position. We can come down again. Just come down a little bit. It doesn't really matter how low you go, just a little bit, as if you were going to sit in a chair here. And back up. And then we'll come down again. Your arms can just kind of sit on your thighs. They can hang off to the side. Just try to keep your shoulders relaxed and your head and your neck in line with your spine. We'll try another one here. Another good thing is to practice your abdominal core contraction here. And we'll come up. All right, we have to stretch out the quad now, if you can. Generally, you can reach behind you and pull on your pant leg, or grab your shoe or your ankle. And we hold this position for about 20 to 30 seconds. Hopefully your knee is pointing down to the floor and not off to the side, and you're not arching your back. And if you can't reach back and grab your foot, you can use a yoga strap to hold onto your leg, or you can use a piece of furniture or something to rest your foot up on. Your knee may not bend that far to grab your foot. So use any of these other modifiable ways to manage that movement. And if nothing else, you can just practice one-legged standing balance with your foot off the floor. You may not be getting a stretch. Okay. Go ahead and get your tube or your weights, and we'll do the strengthening portion of the program. So if you have your weights, that's what I'll be using today. We'll have you raise the arms up just to a level that you feel you can tolerate, and then lower slowly back down towards your body and actually move your arms onto the outside of your body and then just back behind you. So with the tube, it would be the same movement. You'd just be using the tube. We come up and we lower slowly back down, maintaining that good posture. We'll take it up, and if you can only go here, that's where you go, and slowly back down again. Keeping those knees soft. Let's try a couple more, and remember to engage through that abdominal region. So it's as much of a shoulder arm exercise as it is an abdominal and back strengthening exercise. Inhale on one movement, exhale on the other. And stop when you need to. Quality over quantity. Here's our last one, if you've been able to do this many, and lower back down again. All right, you can do all of these in sitting as well. So we'll take it to the next one, which I will turn so you can see what I'm doing here. We'll start out here and we'll pull back like this. Nice and controlled, press it out again, and you can pull back and keep your elbows pretty much close to your body here and press back out. The other way to do it is you actually hold your elbows up away from your body and press back out again. Hold them up away, that's a little bit harder. Press back out again. You could do one of each. Close, and then I change my hand position, and then I do this one. So you get to choose which one works best for you. You can keep it right here, not go too far in front. And then if you have the tube, same thing, except you're just doing the resistance of the tube, right? So just, again, posture and your stomach muscles, tightening of that internal corset. All right, we're gonna go next to the tricep. So you can either do it over your head if you have the hand weights, and sometimes you can do that over your head with the tube, or you can get in this staggered stance position, knees soft, shoulders relaxed, and we do a bend and a straighten. Here's the straighten, it's only of the elbows, and then we go to the bend. So once you get in position, keep your head neutral. So that's why I'm looking out in front of me, kind of down to the carpet. If you can only do one arm at a time, you can do one arm at a time. If you want to do it in the parallel stance, that's fine. You've got to keep our shoulder away from our ear though, and try not to move this part of your arm, so you don't have to be doing this swinging thing. It's more of this elbow movement. Okay. And then we'll do the bicep curl. So a nice controlled bend, bring our hands up close to our shoulder, and then we lower down. So here we go again with an inhale or an exhale. One breath is one movement, and then the other breath is the other movement. You get to pick. Knees are soft if you're standing up. And try not to let your wrists do this, like a bend. So we want to keep our wrists in a neutral position. So don't let them just flop over and bend. Nice and slow, keeping your elbows in close to your rib cage. So don't let your arms come way up here. Pretty much they kind of glue right to your rib cage. And we're not looking to let our wrists flop forward like this either, right? Okay, so those are your strengthening exercises. Now, if you're gonna get onto the floor, have you get your mats out and pillows if you need them, and bring a yoga strap with you if you want to use that on the floor. So we'll start on your back with your knees bent. And just kind of let your body settle to the mat. We'll begin with our knee rocks. So we lower both bent knees a little bit over towards one direction. You can take an inhale breath here, and as you exhale, bring your legs back up to the start position. Now we'll go to the other direction. And then back up to start position. We'll try a couple more. You can move this as small as you need to. If you are able to come a little bit farther, that's fine. Remember to breathe, to coordinate the movement, bringing your legs back up. If you'd like your head to go in the opposite direction of your legs, that's fine, or you can just keep your head neutral. And when you go to bring your legs back up, think about how you can also use your stomach muscles to do that. And you can do as many of those as you'd like. We'll move ahead to the knee to chest. You bring one leg up towards you. The other leg can be bent, or you can straighten it. You don't have to hold on to it, but let's make some ankle and foot circles. So we'll keep this going for about 30 seconds total, 15 seconds in one direction, and then 15 seconds in the other direction. You can do this in sitting. Just lift your foot up off the floor and do the ankle circles there. And then, switching slowly, other leg comes towards you. It's not about forcing it or pulling it. Ankle and foot circles, 15 seconds in one direction. Breathing. And the other direction. 15 seconds is a long time. Keeping the ankle mobile and flexible. You might get a little stretch through the calf or the front of the shin. That's okay. All right. Now we'll stretch the back of our leg, otherwise known as the hamstring, but also the sciatic nerve goes down that way, so we have to be careful if you have sensitive sciatica. I would encourage you to do this movement. You bend and you slowly straighten. You may not be able to get all the way straight. You bend again and you slowly straighten. Or if you don't have any problems with your sciatica, you can just straighten your leg up and stretch the back of your thigh. If you want to point and flex, that's at the ankle. The other leg can be bent or straight. Let's take it to the other leg. This is bend and straighten. If you're having some difficulty straightening the leg all the way out, don't force it. Bend and straighten. If you want to flex and point as you bend and straighten, you can do that. So I'm flexing as I straighten and pointing as I bend. Otherwise, you might just be holding that straight leg and flexing and pointing here if you don't have any sciatica problems. Okay, we're going to take it to the outer hip and buttock stretch. So generally you can put one leg on top of the other like this and just pull this